It's good to have you join us on AD4TV Radio News Update, coming to you live from Abuja, Nigeria's federal capital. I am Merciful Ajinomo. The Nigeria presidency this Friday, in a press release signed by the special advisor to the president on media and publicity, Femi Adesina, announced the death of Malam Abba Kyari, the chief of staff to the president. The chief of staff had tested positive to coronavirus and had been receiving treatment, but he died on Friday, the 17th of April. The National Health Insurance Scheme says it has released advance payment of 3 months premium for all who have enrolled on the scheme, with an advice for Nigerians not to panic, assuring that coronavirus is beatable. The executive secretary of the scheme, Professor Mohammed Sambo, confirmed this to newsmen in Abuja, Nigeria on Friday, adding that from April to June, all National Health Insurance Scheme enrollees could visit their health centers and demand for services without any hitch. According to him, the move is done to ensure beneficiaries enjoy stable health services during the COVID-19 pandemic period. Still talking COVID-19, the Nigerian Defense Academy has designed and produced 2 types of ventilators, hand washers and sanitizers that could be quickly reproduced to ease the shortage of equipment in the country. Major Abubakar Abdullahi, NDA Public Relations Officer, who announced this on Friday, noted that the ventilators' design and production came 1 week after the Commandant Major General Jamil Saham convened a team of engineers, technologists and technicians from the mechatronics department to develop an affordable ventilator within the shortest possible time using readily available components. The head of Department of Mechatronics, Major Abubakar Shurajo Imam, explained that both ventilators dubbed NDA Type 1 and NDA Type 2 could be reproduced cheaply and deployed to combat the COVID-19 pandemic. The NDA, he says, has the capacity of producing 30 ventilators in a month. Still on the pandemic, the governor of Oyo State, Nigeria, Seyi Makinde, said the state government has reached a decision to enforce the use of face masks as the best way to prevent, contain and control the spread of COVID-19. Makinde, in a press briefing on Friday, said that the state government will engage the services of 100 tailors who are expected to produce face masks for 1 million people in Oyo State. He also revealed that one of the 2 COVID-19 cases confirmed yesterday is from Yemetu and the other is a returnee from the United States who is based in Ikolaba area of the state. In another development, 20 people were confirmed dead and 13 others injured this Friday in 2 separate motor accidents in Kano and Katsina State on Thursday night. According to the Nigerian Federal Road Safety Corps, the Katsina mishap involved a head-on collision between 2 vehicles at Chadi village in Sandamu local government area, where 6 people were killed and 5 injured at about 9 p.m. The second accident occurred at 10:40 p.m. in Makole village on the Woodhill Kano Road, where a bus carrying 22 persons unexpectedly burst into flames, claiming 14 lives. Now, the Minister of Health Nigeria, Osagi Ehanire, during the briefing of the Presidential Task Force on COVID-19 on Friday, said the Chinese medical team in the country are still under 14 days quarantine. He said the medical doctors who arrived Nigeria on April 8 are sharing their experiences from a quarantine location via teleconference with officials and partners of the ministry. He noted that the shipment of medical supplies that came in through the United Nations system and China were decontaminated as a routine process. You're watching AD4TV Radio News Update. We'll go on a short break now. More stories when we return. Do stay.
As the world faces the challenge of the coronavirus pandemic and governments around the world are racing against time, AD4TV Radio thanks you all for doing your part to stop the spread of the disease. Be safe at home and practice hygiene. Protect yourself and others. Do not panic. Do not self-medicate. Listen to all preventive advice and stay at home, as well as maintain social distancing. Say no to fake news. Get authentic updates from the Presidential Task Force on COVID-19, the Federal Ministry of Health, the NCDC, and of course, AD4TV Radio, your credible and reliable channel. Please stay safe to save others.
Many thanks for staying. Now to stories on the foreign scene. United States President Donald Trump this Friday announced a $19 billion relief program to help U.S. farmers cope with the impact of the coronavirus, including $16 billion in direct payments to producers and mass purchases of meat, dairy, vegetables, and other products. The U.S. Agriculture Department will partner with regional and local distributors to purchase $3 billion worth of such farm goods to be distributed to food banks, churches, and aid groups as millions of Americans face unemployment. According to a statement by U.S. Senator John Hoeven of North Dakota, chairman of the Senate Agriculture Appropriations Committee, the $16 billion in direct payment to farmers and ranchers will include $9.6 billion for the livestock industry, with $5.1 billion for cattle, $2.9 billion for dairy, and $1.6 billion for hogs. John Hoeven stated that $3.9 billion will be paid to row crop producers, $2.1 billion for specialty crop farmers, and $500 million for other crops, noting that the payments are capped at $250,000 per individual farmer or entity. In another development, President Donald Trump urged supporters to liberate 3 states led by Democratic governors on Friday, apparently encouraging protest against stay-at-home mandate aimed at stopping the coronavirus. At least 2 states under Republican leadership took their first steps toward easing restrictions. A day after laying out a roadmap to gradually reopen the crippled economy, Trump tweeted the kind of rhetoric some of his supporters have used to demand the lifting of the orders that have thrown millions of Americans out of work. Now, the Bill and Melinda Gates Foundation expanded its funding for the global response to COVID-19 with an additional $150 million funding grant and a commitment to leverage the resources of the foundation's Strategic Investment Fund this Friday, bringing the foundation's commitment to $250 till date. Gates Foundation co-chair Melinda Gates said it is increasingly clear that the world's response to the pandemic will not be effective unless it is also equitable. The foundation also called on world leaders to unite in a global response to COVID-19 to ensure equitable access to diagnostics, treatment, and vaccines. COVID-19 patients who are getting an experimental drug called remdesivir made by the Gilead Sciences in the United States have recovered quickly. According to reports, the patients taking part in a clinical trial of the drug had severe respiratory symptoms and fever, but were able to leave the hospital after less than a week of treatment. Dr. Kathleen Mulane, an infectious disease specialist at the University of Chicago, who is leading the clinical trial, said most of the patients treated with the drug have already been discharged, while adding that trials of the drug are ongoing on 2,400 patients with severe COVID-19 symptoms in 152 trial sites and also on 1,600 patients with moderate symptoms at 169 hospitals and clinics around the world. Gilead, however, noted that though anecdotal reports are encouraging, they do not provide the statistical power necessary to determine the safety and efficacy profile of remdesivir as a treatment for COVID-19. In a similar development, the world's biggest trial of drugs to treat coronavirus patients has begun in the United Kingdom and hopes to have some answers within weeks. Peter Hobe, a professor of emerging infectious diseases and global health at Oxford University, who is leading the trial, noted that the trial recovery has recruited more than 5,000 patients in 165 National Health Service hospitals around the UK in a month, ahead of similar trials in the US and Europe. Hobe said the recovery team expects to be the first to have definitive data, which may come sometime in June. The Korea Centers for Disease Control and Prevention have said that South Korea's health officials are trying to solve the mystery of why 163 people who recovered from coronavirus have retested positive. According to the Korea CDC, 21% of the 7,829 people who have recovered from coronavirus retested positive. The same has been recorded in China. In another development, a group of homeless persons have asked to use the athletes' village meant for next year's Tokyo Olympics as a shelter during the coronavirus pandemic. The group sent an online petition addressed to Tokyo Olympic organizers and the city government with thousands of signatures for permission to occupy the massive housing complex. The village, built to be home to 11,000 Olympic and 4,400 Paralympic athletes, is complete and empty due to the postponement of the Olympics until July 23, 2021 as a result of the coronavirus pandemic. Now, Turkey has released thousands of prisoners to reduce the risk of spreading COVID-19 in its congested facilities. Justice Minister Abdulhamid Gül noted that there has been a first outbreak among prisoners with a total of 17 confirmed cases, including 3 deaths. Prisoners to be released on parole and house arrest are pregnant women, women with young children, the elderly with medical conditions, and those with limited sentences left to serve. However, those with charges of terrorism, sex offenses, or drug-related crimes are excluded from the release. Turkey has about 300,000 jailed, and the decision aims to reduce the prison population by nearly a third. China has reversed its official death toll from the coronavirus, raising the number of fatalities attributed to the pandemic by more than a third. Officials in Wuhan, where the virus was first reported, added 1,290 coronavirus deaths to the city's death toll this Friday. Wuhan officials explained that the deaths had initially gone uncounted because in the early stages of the pandemic, some people died at home and medics were focused on treating cases rather than reporting deaths. The total number of cases recorded in the city now stands at 50,333, with 3,869 deaths. The previous reported death toll for Wuhan was 2,579. That's it on AD4 TV Radio News Update, coming to you live from Abuja, Nigeria's federal capital. You can join the conversation on our social media platforms at AD4 TV Radio on Facebook, Twitter, LinkedIn, and Instagram. Please subscribe to our YouTube channel at AD4 TV Radio. Many thanks for watching. I am Merciful Ajinomo.